Hello, and welcome to the CivilTalk Podcast. I'm your host, Topacio Althaus. If you're new to the podcast, this is where we explore civility and social emotional learning in the modern world with esteemed guests, expert insights, and practical advice to help people navigate the world. Today, we are excited to have not one, but two guests joining us today. Some of you might recognize Keith Fox, founder of CivilTalk and our first ever guest on the show. Joined by Keith is Dr. Saurabh Shah, who is a board-certified ear, nose, and throat specialist at Palomar Health, serving North San Diego County. Dr. Shah has committed himself to improving the lives of thousands of patients, helping them breathe easier for over 25 years. Which in a way seems to be what we are trying to do here at CivilTalk, but in a more emotional vein. Welcome to both of our guests, Dr. Saurabh Shah and Keith Fox. We are excited to have you today.
Thanks. Looking forward to the discussion.
Great to be here again.
Excited to have you. So Dr. Shah, I'd love to start with you and hear more about your medical background and career, and basically ask you a few questions about civility within your field of work.
Super.
If you want to start about your background working at Palomar and just what your expertise lies in.
Yeah, well, we're excited to start the Palomar Health Sinus and Nasal Center of Excellence. And really, it is an opportunity to try to elevate the service delivery in North County, San Diego. Specifically, my particular interest is helping make the world a better place, one nose at a time. And so that's really what my personal mission is, professional mission is really helping people breathe easier. And I'm blessed to have been able to cultivate a really solid group of people who work with me, because part of what I wanted to talk about today was, how we all have to understand each other, work together toward a common goal, right? As they say, if you want to go fast, go alone. If you want to go far, go as a team.
Right.
So empathy, emotional learning, and emotional intelligence, these are all critical aspects to elevating patient care for our patients' best satisfaction and outcomes.
Right. Yeah. So how do you define civility in that social emotional learning within your field? So, patient doctor relationship is really important. So how do you, better listening, active listening, how does that really manifest itself within your particular position?
Well, that's an interesting question, but I think the physician-patient relationship is very sacrosanct, and so it's a very unique bond that physicians have with their patients, and trying to understand first, what is a patient's need, and second, how can I best help shepherd them to health in the way that they want to get there? Because there are many tools open to me. They can be surgical, there can be in-office procedures, there can be medical therapies, and a lot of times it's honestly listening. Because one of the key things that breaks down in people is the weight of stress. One of my great mentors at UCSF, he said, stress always hits us at our weakest link. And so understanding where the patient is coming from and where is it that they want to get to. If something's not a problem for them, then we really, in most cases, we don't need to solve that problem. But if something's affecting their lives, then you want to know how it's affecting their lives and how they want to improve. Because again, we have an array of weapons in my quiver that I can use to help combat disease and their ailments. Now, when it comes to civility uh, I mean, I wouldn't say that is more with our patients. I would say that's more with our compatriots, the fellow physicians or administrators or board members in physician groups or different groups within a local community. Now, there's where civility plays a prominent role because, you know, people can have ambition, and there can be different groups of physicians. And so we all ultimately we want to work together to serve the health of a community. And so I think that's important. And as I've grown in my medical career, I've learned how to become more civil, how to understand other people's perspectives.
Right.
Right. I think as a surgeon, especially if you're trained pretty well or at big name institutions, you come with a lot of ego when you leave your training. But I think one of the things I was talking to Keith about just the other day is it's very humbling.
Right.
You have all this training. I went to Stanford as an undergraduate. I went to UCSF as a medical student. I went to UCSF for my internship and residency. And these are some of the great institutions. But the day you enter into, let's say, your first clinical round, clinical rotation, you literally are the dumbest person in the hospital. You have no idea how to make things happen in that hospital environment. So you have to learn how to work as a team with the nurses. As you advance in your career, you then have to, you become a resident. You have to learn how to work with your co-residents. And I've got one of my friends from residencies coming to have dinner at my house. 35 years later, he's coming this Thursday. And we honestly were great friends, but we had to learn how to work together because we each had our own ambitions during residency. Then as a chief resident, you have to learn to work and teach residents underneath you. And then perhaps more so as you become out on your own and you're trying to make a name for yourself, or you have certain objectives, well, you have to work with other doctors in the community. And then when you get to higher leadership roles, you have to work with hospital administrators. Often you have to work with publicly elected officials to serve the health of a community. So I hope that answered your question, but.
Yeah, actually that answered both my questions because my other question was going to be, when you first start out, I'm pretty sure those skills are at an all-time low. And like with any profession, whether it be medical or anything, you start out with a huge ego and then you realize, you don't know as much as you think you know, and it humbles you, but what advice do you have for medical professionals who are first starting out, for young, entrepreneurs too, but people in the medical field? What is something that you wish you kind of took into your profession when you first started out that you had to learn over time?
Yeah, I think you touched on it. I would say that ego is the enemy. You need to have a great dose of humility. No matter how well you're trained, you need to understand. Young physicians and surgeons need to understand that it is very much a healthcare team that allows effective and efficient delivery of well-being to a patient. There are key notes there in terms of the center of excellence. What we're trying to do is elevate the functional excellence within a health district that perhaps may not have had the same level of functional excellence as others. I mean, I was chief of ENT in Salt Lake City at LDS Hospital, which is part of Intermountain Healthcare. And that is one of the best run healthcare systems on the planet because there is a way to do things. Everyone follows the outlined objectives. everyone follows the mission, vision, and values of the larger organization. So you have to work as a team toward a stated and unified objective.
Mhm.
And when you don't, when you have groups that are factioned off, and this gets to civility. For instance, like in the United States of America, there are groups that are factioning and kind of at odds with one another. But ultimately, we have to remember we're all here serving the country.
Mhm.
We have goals as a country, and we're all unified in that sphere. So you have to subjugate your ego a little bit. You have to work as a team. And that's where civility really comes into play, and particularly emotional intelligence.
Mhm. Right. Appreciate that. And have you seen a huge lack? Like, what are the things that you do? Because, we can talk about this and various individuals could have this skill, but there's always going to be people who don't have that skill and don't learn through other people. You kind of, in my life too, you kind of, if I can't teach someone, I sort of teach them by practicing,
You teach
what
them by
happens?
practicing?
Yeah. So hopefully, practice what you preach, right? So hopefully people let on and see what you do and mimic in a way your behavior, whether it be in an interpersonal relationship or your coworkers. A lot of people just don't understand and can't understand civility and social emotional learning in a scholastic way. So you try and implement it through the way that you go about your day-to-day life. What do you do in those situations in your medical field when there are people who just kind of aren't getting the memo and there's a breach of that civility, and there's incivility in the medical field? How do you, as someone who has a lot of experience in the medical field, how do you broach that with your
Yeah, well, I think one of the things that you're asking about is, see, overall, I think we all fight this war within, in terms of we want at all times, we want our intellect to control our emotions. And yet, when we receive stimuli from the outside world, I'm going to get maybe a little scientific on you, but when we receive stimuli from the outside world and we have this reticular activating system that's processing thousands of pieces of data around us, what happens is a lot of times we feel something before we even know why we're feeling it. In our limbic system, in our amygdalas, we can feel fear, we can feel anger, we can feel certain emotions. So one of the great things Keith's taught me is, hey, Doc, one of the first things you've got to do is label that emotion for your own personal good. If you act on an emotion, now you're not emotionally intelligent. Keith's really taught me, hey, your first step is to label that emotion. And it really, if you read about it, and people like Daniel Goleman write about this, Travis Bradberry write about this, it takes a full 90 seconds to kind of process emotion and calm it down to where you can use your intellect to control your actions. So really, honestly, what you want to do in any field, whether you're a podcaster, an attorney, a physician, a surgeon, whatever it is, the more you can use your intellect to control your emotions, and the more you can use control of your emotion to achieve your objectives, well, then the better off you are and the more emotionally intelligent you are. And so by labeling an emotion, that's a great hijack of this cascade that often triggers us. Because if you label the emotion and you can say, hey, what is it that I'm feeling right now? I'll give you a little, another nugget is it's impossible to be curious and angry at the same time.
Right.
So a lot of life becomes a negotiation.
Right.
And so if you can be curious as to why someone else is coming from the position they're coming from, then it's Chris Voss, who's a negotiation expert, he talks about this a lot. He says in his books that if you can be curious as to where they're coming from,
Mm-hmm.
then the art of negotiation is using what he calls tactical empathy to allow others. It's the art of allowing others to have your way.
Right.
And that's what negotiation is, successful negotiation.
Right.
But so much of life is controlling your emotions, regulating other people's emotions, pulling little strings. I mean, as a patient, let me go back to patient care. As patients are often so fearful.
Right.
So sometimes the emotion of humor, like I'll chuckle. I always get to know my patients. And then often I'll try to bring humor into an interaction early, because a humor, a chuckle, it lets all of the tension out of the room. And now once someone feels comfortable with you, they can really express what it is they want to express. So there's an old adage in medicine that people don't care how much you know until they know how much you care. And so all these kind of nuggets grow on you over the years, over the decades. I mean, I've been a surgeon for 25 years now on my own. I mean, that's a long time. Think of the thousands of patients I've operated on, the tens of thousands of situations that I've seen people in and coming to me. And you're really trying to decipher what's going on with this individual patient.
Right. There's a lot of sort of detective work involved in your line of work, which I'm sure you.
But when you're early, that's a good point. When you're early, I used to love detective stories like Jupiter Jones and the Three Investigators or the Hardy Boys. And I thought, hey, medicine's a lot of like detective work, trying to figure out a disease process. But I really got to be honest with you. So much of this is finding out the emotion that someone's feeling and the source of their stress.
Right.
Because stress creates disease. So let me say that again. When we have stress, it hits us at our weakest link. And that's where our bodies tend to break down. So I give you a perfect example. I do ear, nose, and throat surgery. And a lot of times people will come with dizziness and that can often be migraine associated vertigo. And so the stress of a tension headache that crescendos into a migraine can cause you dizziness. And now they're looking for inner ear disorders, but it's really the stress of it that gets you. Does that make sense?
Right. And so you manage that stress, you're a stress manager and detective at the same time.
Yeah, because you have to get it out into the open. So you're a detective not only of the disease process, but the underlying emotions that lead to that disease.
Right.
And so, okay, another great example is that of cancer. You can have a stage 2 cancer in one person and a stage 3 cancer in another. And you really can, as you start to get to know that patient, you can get a read on their attitude, their optimism, their social support networks, and even people who have higher stage cancers. If they have all these other things working for them, I can almost predict they're going to have a better outcome than a person with a stage 2 cancer who cannot get over the fact that they have a cancer. Why did this happen to me? They don't have a social support network. They're constantly worried about what's going to happen next. I mean, that's how stress can deteriorate our bodies.
Right. Yeah, it's hopefully it's something that we can all learn with time. That's kind of what we're trying to do at CivilTalk as well. I know with my experience with doctors, emotions don't really pop up very often. And like you were saying earlier, we don't talk about emotions, but we show emotions. We show by doing. And so hopefully with Civil Talk, I kind of want to have, Keith chime in as well, and like what Civil Talk and, I think there need to be more companies and businesses that integrate something like Civil Talk into their curricula. Obviously, Civil Talk is trying to implement into UConn and into universities, but I'd love both of your opinions on hearing about, can there be a space, an integrated space, in a conscious space for teaching this in the medical field?
Yeah. So, well, first of all, I want to thank Doc for coming. We've become good friends, and as you can see, he is a wealth of knowledge, and like me, he has a growth mindset. We never stop learning, and so I learn as much from him as he's learning from me, and it's a joy for us to spend some time together, especially on this. And thank you for the kind words.
Oh, it's my privilege. Yeah.
With Civil Talk, the previous episode you did with Mike around engineering put a spotlight on the fact that regardless of your occupation, regardless of the industry that you work in, these are foundational skills that all of us can always strengthen. Civility is a choice. Every day we make a choice. You have an interaction with somebody, and to Doc's point earlier, you make the decision with your emotional intelligence skills on how to interact with that person and how to manage your emotions to the goals you have. And if it's with your spouse, that's a love of your life, and those interactions are prioritized, and you do everything possible to be thoughtful and loving, even when you disagree. And I've been married 40 years, as I mentioned in our first podcast. You're never going to agree with everybody on everything. So it's you're labeling your emotions, you're being self-aware, and you don't want to react. You want to be thoughtful and interact with others. And that's a learned skill, and you have to continue to do it. And as most of us, have learned, social media has really put a spotlight on getting people to react, right, and not take that time that Doc was talking about to really use your intellect to think about, well, how am I feeling? And then how should I react in a thoughtful way to the goal that I have? And so those tools, those services were built to get people to react, not to think.
Right.
And it's caused a culture of incivility, these last 10, 15 years. And this is going to be a lot of work for our nation to undo that. And so Civil Talk, is created as a service to help put a spotlight on this. Again, regardless of the occupation, we're in universities so that students in the health school, dentistry school, pharmacy school, the business school, the engineering school, liberal arts, law school, this is a skill that everyone needs to put a focus on and make a commitment to be civil with others. And it's not easy. So, we purpose built some features. You have to label your emotion on an interaction on Civil Talk. And to Doc's point, that's kind of the first thing is self-awareness. And so, the service is a social emotional learning service. We're not trying to sell ads. We're not trying to get people to react. We're trying to teach people the good habit of strengthening their own emotional intelligence skills and civilly interacting with somebody, even when you disagree. And
right.
that's the purpose of the service. So.
Right. I think educating people about the array of emotions, because we have so many emotions. It's not just happy, sad, anger, fear, the actual wheel of emotions. If you see the color display, there's so many different gradients of colors. And I think teaching people about the array of emotions allows people to have a more comfortable relationship with their emotions, less stress. Dr. Shah, you might be out of business. Less sick people. Just kidding. But yeah, I think having that in fields where the medical field or business fields or college fields, especially right now, is so important, especially with political climates and that are ever changing. But integrating that also, offline as well, having CivilTalk sort of be an offline process too, I think is important as well. And having the integration of digital, which we are digital, and then eventually hopping on over into, one-on-one vis-a-vis sort of relationships that are improved, I think is
one of the things I think is you and I have chatted, and Mike and some of the faculty at UConn, we've learned is this tool and other digital tools really are used in what's called a blended learning environment.
Right.
So, we're doing it right now, right? Doc and I are here in person and have been talking, prior to getting on and do that all the time.
Right.
But now we're interacting on an audio video digital call. And then, we'll probably follow up with an email or a text or a post on CivilTalk.
Right.
And so learning how to live in this 24/7 digital world is a requirement. This is especially in the United States and in developed countries, a country where 96% of the people have a smartphone. This is not an underdeveloped country. This is a developed country. And so it's the first generation not to know life without a smartphone.
Right.
And, we talked about that in our prior podcast, that if you're being taught to be uncivil by being on social media and watching people react to other people's posts all the time, you're unlearning your own emotional intelligence development skills and civility skills.
Right.
And so you really have to be conscious about this. And if you're very shy, you may actually online in an authentic environment like CivilTalk get a voice.
Mm-hmm.
And so then when you do go into class, others will have heard you, where if you're only in class, only in an analog situation, and you're shy, you may not speak up.
Right.
So hopefully that blended learning that we're providing and encouraging gives everybody a voice, the most shy person and the most outgoing person, and everybody gets to be heard and interact in a civil.
I think you had mentioned before in a few meetings we've had, and I always kind of laughed about it, but it clicks now. You were like, civility is cool, and you would say that a few times. And I feel like it's so important to sort of push that too, because the more you act quote unquote civil and respectful, it does kind of feel cool, especially when you seek out mentors. You're each other's mentor, and the mentors that which by the way, Keith, you were definitely one of my mentors. But it's funny though, because, the older you get and the more you acquire mentors, the more you actually do realize that civility and being respectful does equal success on so many ventures of your life. And it is by proxy cool, and so getting like college students to understand that, I think is like really interesting. But also I think as you get older and you delve further into your career, like Dr. Saurabh Shah, you do realize that, civility in the most informal sense is cool. So.
Yeah, but I want to pick up on that thread. So earlier today, I had a little mentoring session. I mentor a Navy SEAL. And one of the things he taught me is that really the art of war is to subdue the enemy without fighting. I mean, this guy literally could kill any person in front of him in the matter of seconds. And I've seen him over the last 3 years as I mentor him, learn how to, I work with him on harnessing his emotions, because when you're transitioning from a battlefield environment to now he's going to become more of a business person in a professional environment, well, you have to harness that power that you have. Similarly, if I see situations where Keith has been frustrated by certain things, because he's an entrepreneur, and per force entrepreneurship means that you are going to encounter situations that are frustrating, and you will have to pivot, or you will have to assess your environment and adapt. Okay, so I can watch how he handles those things, right, and how privately we may chat about how upset someone or something or some process has made him feel. But then I see the tactical elegance with which he handles it, whether it be an online email or an in-person discussion or on the phone. And obviously Keith deals with some very powerful people. So, he gets his message across, but it isn't combative. I think that's one of the things I learned. I spent the first 16 years of my postgraduate career as a surgeon in Salt Lake City. And then my daughters wanted to play a lot of tennis, and we moved out to San Diego, Southern California, so they could train. And actually, it was a chance for me to execute on a better way of being with my colleagues, not be as combative in trying to achieve my personal goals or the groups of surgeons versus primary care doctors. That was a big battle I had in Salt Lake City. I mean, the surgeons loved me, and the primary cares were like, who's this guy? It's pretty inflammatory. So when I came here, I was more, hey, let's try to be friends with everyone. Right. Let's really get to work and put on. One of my mentors, Nadine Bakazi, is a great mentor of mine for the last 30 years. He was one of my chief residents. And when I was moving here, he actually told me, he said, listen, Doc, you got a new chance for greatness. So every day before you walk into that clinic, put a smile on your face and make the workplace a happy place. Right. And that was such good advice, because that's really something I try to do a lot of, because happiness can be contagious. We've had some difficulties with our computer systems at Palomar Medical Group, and it's been rough. But, as best I can with the patients or even with my staff, I try to try to crack a joke, because humor can diffuse a lot of tension in an environment. And once the patients know that you're suffering just as much as they are with the lack of necessary computer framework right now, boy, they can empathize with you. And then we can get back to the delivery of healthcare. Yeah. So I don't want to talk too much about that, but that is some of a problem in an area that I've had a lot of growth in the last 8 years.
Yeah. And I just want to pick up on a nuance that sometimes people misinterpret the real definition of civility. Mm-hmm. That they think, oh, you want me to be polite all the time and not actually speak truth. I just have to be polite even though I disagree. That's the farthest thing from the truth of being cool and being civil.
Right.
You can be very empathetic, very understanding, use reflective and listening skills, and accomplish not only your goals and objectives, but the team's goals and objectives. And people can see the positive outcome of that.
Mm-hmm.
And that is cool, that you can use your intellect and get to a place where everybody wins. And so civility is really how you act when you disagree or you think you might disagree with others, to accomplish goals and objectives to the vision and mission of the organization you belong in, whether it's Palomar Health or an independent clinic in the healthcare world. Or I just posted about Coach Hurley with the UConn basketball team. What a wonderful video that was captured of him on his principles of leadership, and embracing the concepts of civility and emotional intelligence, and accomplishing goals and objectives, winning national championships, and being a team player. And just, if you haven't watched that, I posted it not only on CivilTalk but LinkedIn. A wonderful example in the sports world, and we're talking about in the healthcare domain. But again, these principles are universal, regardless of occupation or industry.
Right, they truly are universal, and I think it's important for our listeners who are listening to understand, whatever field you're in, what is your definition of civility? Taking a moment for that today to whoever is listening, whatever you do, whether it be just, being a mom or a father or a great son or daughter, or, whether you're in the medical health positions, what does civility mean to you? Taking a moment to think about that today. For me, I have taken away, compassionate curiosity is what civility is for me. Disagreements can also be seen as compassionate curiosity. You can ask with compassionate questioning. For me, that's really big, and I've learned that from another mentor of mine, psychotherapist Terry Real. But I want to thank you, Dr. Saurabh Shah, and obviously Keith Fox, for the amazing discussion we've had today. Dr. Saurabh Shah is at Palomar Health, and Keith Fox is founder of CivilTalk. I just want to thank the two of you today for being here today and having a great discussion.
No, thank you too.
Yeah, great job, Topacio.
Thank you.
Nice to
Thank
get
you.
to know you.
You as well. Hopefully see you next time.
All right. See ya.
Bye.